Hi, everyone. I am Dr. Aravind Veerapandiyan. I'm a pediatric neuromuscular neurologist at Arkansas Children's Hospital. And I'm joined by Dr. Caitlin Batley today from UT Southwestern in Dallas. So let's talk about some of the exon skipping trial updates from the conferences. I was excited to see Del-Sota, the exon 44 skipping drug from Avidity. I'm curious to hear your thoughts on their data.
Yeah, I thought really exciting results. We saw a significant increase in dystrophin production, as well as an increase in exon 44 skipping seen in muscle biopsies. So that was very reassuring. And then the patients in the trial also had a sustained decline in their CK after treatment, their creatine kinase level. And so this was, I think, it was extra interesting because we know that all of these boys are on stable doses of corticosteroids in this trial. And so the fluctuations in CK are at least not related to changes in their immunosuppression or changes in their steroid dosing, although this number still does fluctuate on a day-to-day basis.
I agree. I think one other thing that was kind of catchy for me was also the CK levels actually went down towards the near normal. Like if I don't think we have seen that in any other programs, but and also when the ones in the placebo group kind of switched to the treatment arm also it went down, and that exon skipping data was also good in both those levels, and I think they were similar for both 5 and 10 milligram group levels. So I think they decided to proceed with 5 milligram per kilogram every 6 weeks as their dose levels for the future program and trials. I think from a safety standpoint, can you think of anything that pan out from this study?
Yeah, I think also safety-wise looked very reassuring. We know that hypomagnesemia can be an issue with some of these different exon skipping therapies, and that was really not seen in this trial. There was some episodes of hypersensitivity or anaphylactic reactions, and so that is something to always keep in your mind as we're potentially using new therapies. But overall, very reassuring safety profile.
Yeah, sure. Yeah, I think there was 1 or 2 cases of anaphylaxis, if I remember correctly. All right, I think we had a few other programs. This is one of the exon 44. I think we had a couple of exon 51 clinical trials that was going on, and they shared some results at the MDA meeting. So let's look at the PepGen exon 51 skipping therapy. Your take on that program or data?
Similarly to what we saw with Avidity's program, we saw an increase in levels of exon skipping. We also saw an increase in dystrophin expression. So these were, very reassuring findings. Overall, this drug also seemed to be safe with a pretty good profile, although there were a couple of cases of hypomagnesemia. None of them had clinical symptoms related to this, although they did need to take some low-dose magnesium supplementation.
Any other adverse events in addition to hypomagnesemia?
I believe those were the most notable ones and the ones related to study drug or thought to be related.
All right, Caitlin. Let's talk about some of the exon skipping programs that were discussed at the NDA. I know there were quite a few exciting to see those updates from different programs. So one of the programs that actually has some functional data out there was Dyne on the exon 51 skipping program. Do you have any thoughts about that?
Yeah, this was another exciting presentation because in addition to seeing, the very reassuring increase in dystrophin expression, as well as evidence of exon skipping seen in tissue, this also showed us some functional data. And we saw that both patients who were treated in the lower dose of 10 milligrams per kilogram, as well as the higher dose of 20 milligrams per kilogram, all had improvements in their functional outcome measures, the North Star Ambulatory Assessment, the time to rise from the floor, and the 10-meter walk run. And for those patients who were treated at the lower level and then rolled into the 20 milligrams per kilogram in the open label extension, this improvement was sustained as well. So this was really exciting data to see.
Awesome. And their dosing is also every 4 weeks, right?
Yes, correct. Every 4 weeks.
Yeah, I think I'm excited to have these so-called second generation exon skipping agents where we don't have to poke our patients once a week for these, and also think about the logistical challenges with that, where you don't have home infusion and things like that. I think it's exciting to see these different programs coming up. I'm also curious about your thought process or take on when trials report the dystrophin content, muscle adjusted versus just naked dystrophin amount or percentage. Any thoughts around it?
Yes, and it definitely can be hard to interpret some of the different quantifications and numbers that we're looking at when we're looking at biopsy results and dystrophin expression. And we also know that in each of these trials, all of the inclusion exclusion criteria are slightly different. And so it'll be difficult to compare one to another with kind of complete accuracy. But I think overall, very reassuring to see the numbers moving in the right direction with increased dystrophin expression, which will hopefully translate into, a good functional outcome for our patients.
Yeah, great. I think another program that had exon 53 skipping was Wave. Did you get a chance to look at that data? Any thoughts on that?
Yes, definitely. And so another really exciting program. And in addition to noticing that there was an increase in dystrophin expression, this trial also looked at kind of overall muscle changes, and their outcomes were also exciting to see that there was a decrease in muscle fibrosis. And so they saw from, baseline to follow up that there was decrease in inflammation, decrease in necrotic fibers, fewer regenerating fibers, and more mature muscles. And so that was exciting to see some also kind of supportive data that were impacting muscle health.
Agree. I think their safety profile was also favorable. They were mild, if I remember correctly. Most of the side effects they report were well tolerated.
Yep, agreed. And I don't believe any patients discontinued the study due to side effects. So overall seemed to be a favorable profile as well.
Did any of the studies, the programs that we talked about, included, gene therapy treated patients, for example? And that's something we are moving ahead in terms of add-on therapies, combination therapies. Any programs included that?
That's a great question. I don't believe so. But that is, I think, kind of the next step and hopefully something that we'll be seeing in future clinical trials.